everybody. Happy Super Bowl Sunday. In addition to the Super Bowl, and in addition to Groundhog's Day, it's also my birthday. 32 years young. Why are y'all laughing? Okay, I'm not 32, 37. That's when you're getting old, when you say you're 32 and people laugh. That's not a good thing. I also didn't get carded for my beer last night, which is starting to get depressing as well. Quick poll of the audience. We saw our student-run free clinic, Society of Student-Run Free Clinic participants here. Are you all mostly medical students, nursing students, PA, pharmacy? What's your background? Some of everything? All right, so I heard pharmacy, PT, that kind of thing. And how many people here in the STFM crowd, how many are resident physicians? Any residents here? Attending physicians, raise your hand. Other non-physician providers as well? Any allied health, social worker, anything? Awesome, good. So now more important poll. Denver Broncos fans, raise your hand. All right, Seahawks fans, raise your hand. How about if you're not a fan of either team, but you just want Peyton Manning to win? Okay, last question. You're not a fan of either team, but you're just rooting against Richard Sherman. Raise your hand. If anybody doesn't know the joke behind that, just Google Richard Sherman. It's kind of the anti-STFM/SSFRC. He's a guy, in case you didn't know, who sort of just was boasting after the last game, saying he was the best player in the world and everyone else was terrible and sorry. But that's been the opposite of what I always feel when I come here, which are just a lot of humble people who are just happy to serve and help other folks. And it's always an honor to be here. So thanks for having me. So I love this meeting of STFM with the Society of Student-Run Free Clinics. It seems like such a natural thing. Just being around academic family medicine educators always is very inspiring for me. Being around the students who work in free clinics and do a lot of volunteer work, their energy, their enthusiasm is just infectious all the time. So every time I come to a place like this and around the students and around other educators, I always go back just revitalized. So it's an honor for me to be here for sure. So my first experience with student-run free clinics came back in 2002. And I was an intern in family medicine at UNC in Chapel Hill. And I heard about this thing called the Shack Clinic. Does anybody from UNC here? Raise your hand. Anyone who's volunteered at the Shack Clinic, throw your hand up as well. So the Shack Clinic is like they said, is the oldest student-run free clinic in the country. And I got there as an intern, and they said, hey, a lot of the residents participate in this thing called the Shack Clinic. They go and volunteer. And I heard about it, and I said, wow, this is just right up my alley. For medical school, I went to Morehouse School of Medicine, and the mission of Morehouse is to train people to go into underserved areas and also, in particular, to focus on the primary care needs of underserved populations. So at UNC, we had a mixed patient population in my own continuity clinic. There were some uninsured patients, some Medicaid patients, but there was a nice mix. But this was just right up my alley, just spending some time just taking care of completely underserved patients. And that was what I was just sort of pushed towards from my first day of medical school. And so I went to the Shack Clinic and had never, had volunteered at different homeless clinics and things like that. But the first thing that struck me was just how enthusiastic the students were. And does anybody remember Ace Ventura, the Jim Carrey character? So I remember the first day I went to the Shack Clinic, I barely got out of the parking lot. I was walking up to the door, and the door flung open, and this medical student popped on and was like, hey, Dr. Reddick. Hey, how you doing? And it's like, wow, this guy's a little excited. So introduced myself and said, oh, you're here to volunteer? Awesome, we're so happy to have you. And then I ran into another Jim Carrey character, and then another one, and another one. And I realized that's how all the students were. Everyone was just so enthusiastic. And Shack Clinic typically runs from about 6 in the evening to about 10 o'clock at night, or at least it's scheduled from 6 in the evening till 10 o'clock at night. For those who volunteer knows sometimes it's 11 o'clock or sometimes midnight when we used to get out of there. So, but it didn't matter. The enthusiasm of the students just went on the entire evening. They were just always happy to learn, always happy to serve folks, had a smile on their face the entire time. Excuse me. The one other neat thing that happened with that was that over time, around 2002 when I started, through 2010, the clinic just evolved. Initially, it was only a primary care physician focus, and then over time, all of a sudden, they had dental there, and then they had social work students, and then they had physical therapy students, and nursing students, and pharmacy students, and residents from all those different disciplines as well. And as I started meeting other people from other clinics, I found that a lot of the student-run free clinics are the same way, which is huge. In family medicine, we know all about interdisciplinary care, about working with teams, working with different disciplines. And so that's obviously the future of medicine in general, and that's how people are going to get healthier. So I was really, really pleased to see that. Excuse me, sorry. Also, just as I've been meeting people and getting to know other folks who are involved in some of the different student-run free clinics, I ran into a young lady from Texas Medical Branch in Galveston. Anyone from that clinic by any chance? All right, super. And it was just and saw that they not only just primary care, but pharmacy and dental, but apparently they have psychiatry services and even neurologists and nephrologists that are even volunteering there. And they've actually gotten the reputation of being a kind of referral center. So whenever local physicians see an uninsured patient, they say, oh, you should go to the St. Vincent's Clinic in Galveston. And so it's just real neat just seeing all over the country. I believe right now there's 142 different student-run free clinics that are registered with SSFRC. And if you just kind of go on the website and look at all the different services they provide, it's just amazing. So again, the marriage of STFM and the SSFRC is just natural. It's a perfect union between the two. Because a lot of the people, again, who are involved in family medicine education or involved in student-run free clinics, they need to have a wide variety of skill sets. And it's not just free clinics, but a lot of the students who do that also do things like global missions, medical missions, international health, or even just things, homeless clinics or different urban clinics in different places. So just to give an example about just how that family medicine skill set applies so well to this scenario. A lot of the times when I was at the Shack Clinic, you run into the same students over and over again. And like they were saying, like Aaron was saying earlier, I used to do medical mission trips to Honduras every summer. And so we spend a month of July down there doing cervical cancer screening, doing some other kind of acute care management of medical problems. And one night, one of the hosts that was actually our liaison down there, her brother was working in a mine, and a shard of rock just went and shot into his arm. And so he had this big knot just sitting in his arm, and it was painful. And he said, oh, my gosh, what am I going to do with this? And we literally traveled around town to town, just, by horse, and found some betadine and found a scalpel in another town and found some suture that they had packed away in some suitcases for the mission trip, and eventually just got our supplies together over about a period of about a day. The area we went to had no running water, no electricity, so the students used their headlamps and all kind of crowded in and made a nice light for me. And in somebody's living room, I opened up his arm, took the huge shard of rock out, and stitched him back up. And in addition to that, and that's something you may say, oh, well, a general surgeon could do that, or a lot of providers could do that. A lot of non-physician providers could maybe do that. But in addition, from day to day, from week to week, no matter what pops up, we were always ready a lot of times. So when someone needed an IUD in, we were there to put that in. When someone had a common cold, we were there for that. They had back pain, we were there for that. And we had a lot of students who were initially saying, oh, yeah, I want to go into pediatrics or I want to go into OBGYN, who will go on those trips and say, wow, to really, really take care of anything that walks in the door and people in underserved or low-resource areas, family doctors are really, really well-positioned to take care of those patients. So, again, I love this union of the two organizations, and I hope that it continues for many, many years. Excuse me. So, in the last few minutes, I want to talk about free clinics in particular. And are free clinics truly free? Raise your hand if you think so. No one. So I remember in the 5th grade, one of my teachers used to always say there's no such thing as a free lunch. And a lot of us used to argue back with her because there actually was free lunch at school every day. And but she said, no, somebody is paying for that, no matter what. There's always somebody paying. So the question is, for free clinics, who's paying? Anyone? Anyone? You guys are paying, right? With your time, with your energy, Your family's paying maybe because you could have been home at 6 o'clock, but you're home at midnight instead. Loved ones, the buildings that house those clinics are using their resources to hold them. A lot of grants pay for or provide the funding for a lot of these clinics. So there's always somebody paying. So the other question is, are free clinics really important? Is this something we just do for fun to make us feel better about ourselves and pad our resumes? Do they really matter? Is this a thumb in the dam where you have somebody and you temporarily give them a little bit of help, but it's not going to make a long-term commitment, not make a long-term change or impact? What about with this Affordable Care Act business? Is everyone going to have insurance and nobody's going to need free clinics anymore? Are we wasting our time here? I gave a talk a couple years ago. Of course, I'm being a little bit facetious here, but I gave a talk on health disparities a couple years ago, and I said, Barack Obama's president anymore, so we don't have to worry about this stuff anymore. So obviously that's not true. So to answer the question, are free clinics really important? Are they going to go away? Or are we going to not need them as much in the future? My answer is it doesn't matter. I'm going to tell you why not. So in my opinion, the organization and the structure of free clinics are not what's important. What's important is the spirit that leads to the free clinics. And that spirit and that energy that's here right now. That's what's the most important thing. So it doesn't matter what structure or how it's organized in the future, that spirit's going to always be there. And it's going to get translated into care and compassion and better health for patients somewhere. For some people, even if we had everyone insured, what are we going to do with the insured patients? For those of you who may practice in North Carolina who are familiar with CC&C, there's when patients get Medicaid and they're higher risk patients, there's a case management network that actually helps to take care of the highest risk patients. It's actually shown to actually decrease healthcare costs significantly, even though you're putting extra money into case managers and social workers and nurse educators. And so that energy is going to always be needed. Those kind of skills are going to always be needed no matter where people are practicing. And for our non-physician providers, a lot of your care transcends insurance status. And again, we mentioned already the importance of global mission work. So just to show a few pictures of the Honduran Health Alliance, and again, this is another free clinic that is actually a free clinic abroad. And again, even if by some miracle everyone in America were to have insurance and healthcare access never became a problem, your help's needed all over the world. So for each of us, everybody's different about what drives your energy and what makes you want to do what you do. And so as we kind of close this morning, I want you just to think about, as you go back to your respective lives and careers and in school, just think about what it is that brought you here. What is it that drives you to do what you do? Again, you don't have to be doing this. You don't have to spend time planning and scheduling and going to take care of patients. And for our social workers, chasing down patients maybe without pay to take care of their most challenging social needs. For pharmacists who have patients that have medication lists that are this long, digging through when you're not getting paid. Same thing for our attendings, our residents who volunteer at these clinics where you're not getting paid. Why are you doing it? And just think about what it is that drives you. Everybody's different. For me, my faith is a big part of my life and guides a lot of decisions. You may say, a lot of, why not all of my decisions? Well, I don't know. I don't think God cares who wins the Super Bowl tonight. But a lot of my decisions. And one thing I think is important for me, I always feel compelled to share, is that the irony is that a lot of times people use faith as a reason to not support things like what we're talking about today. So somehow faith gets twisted to say, oh, we shouldn't be trying to pay for people's medical care. They need to pay themselves. And oh, no, we shouldn't be giving everybody insurance. And no, we shouldn't give people public safety nets. We shouldn't be doing all this stuff. That's against my faith. And the irony for that with me is that they profess the same faith that I profess, but I don't know, maybe we're reading different books. Because when I read my Bible, it says, if anyone has material possessions and sees a brother or sister in need but has no pity on them, how can the love of God be in that person? Paul, who wrote more of the Bible than any other person, when he was describing pretty much his mission, what his goal in life was. It was to go out, meet as many people as he could, and the very next verse said, all they asked was that we should continue to remember the poor, the very thing I had been eager to do all along. So this is my daughter, Gabrielle. She's 7 years old and desperately wants to be a doctor. And it was interesting. A couple of days ago, I was talking to her about, she heard about medical insurance somehow, and she was trying to understand insurance and how it worked. And so it was really, I guess it's kind of confusing for any 7-year-old. And she was saying, so you don't have to pay a lot of money when you go to the doctor, or does it cost a little or a lot of money? And I was explaining it costs a lot unless you have insurance. And she was like, what's insurance? I said, well, you kind of pay this company money, and then they sort of pay for your health care. And then she was like, but why do they pay? Like, how does the doctor make the money? Well, they give the money. Well, what is the company? How do they get money? Well, I pay them money every month. It was confusing. And so she was like, I don't understand that. And so that's my son. And so my son was just kind of sitting nearby. And he said, you have to pay money to go to the doctor? I said, yes, you do. So if you get sick and you go to the doctor, you have to give them money? I said, yes. He said, well, what happens if somebody doesn't have any money? And I said, wow, this is perfect timing. This is about a week ago. And so, and it's right before he turned 5 years old last Saturday. So it was a couple of days before that. And I said, Luke, what do you think should happen if somebody's sick and they go to the doctor and they don't have any money? What do you think should happen? I said, if you go to the store and you want a toy and you say, I want that toy really, really bad, and you don't have any money, they don't give you the toy. And there's nothing you can do. You have to go home and find some way to get some money. So what should happen if somebody goes to the doctor and they don't have any money and they're sick? He said, you help them anyway. And that is one of my most proud moments that he said that. So again, quick story. Again, as far as why are we doing this, I know the answer. You guys are not doing this to pad resumes and to as job requirements. You guys are doing this because you care about other people, because you want to help anyone who's not as fortunate as fortunate position as you may be in. And I've noticed that a lot of students who are involved in student-run free clinics, when they get into those residency programs they wanted to, or when they graduate from those residency programs and get those jobs they wanted, they don't stop serving. One story, one of the students who was at UNC that I ran into multiple times at the Shack Clinic that I was telling you about, she also went to Honduras with me twice on two different medical missions, and her resume was just padded with just service, just years and years of service. And when I left Chapel Hill to move to Wilmington, she was graduating from UNC's medical school and went to Wilmington for residency. And just coincidentally, I was her advisor in residency as well. And so she got the residency and was like, oh, is there anything like this Shack Clinic that we had? And I said, well, there's not a medical school affiliated free clinic. There's a free clinic downtown that I work in, but it's kind of mostly just the attendings working right now. And we don't really have any medical students or anything like that. She said, well, can I tag along and go with you? I said, yeah, sure. And then within about a month, almost every resident in our program was volunteering down there, to the point where now I pretty much just go in precept and don't see patients because there's so many residents that if I saw patients, they wouldn't have enough patients to see. And again, free time. They've already gotten a residency. They don't need to pad their resumes anymore. So, I've noticed, and again, that same student or now resident, she's actually joined me to 2 more medical mission trips to the Dominican Republic as well. So these students, they keep doing this. This is something the people that are here, you guys are going to be doing this your whole life, no matter where you are. And it may be in a different setting. It may not be a medical school affiliated free clinic. It may be overseas. It may be in a health department or a community health center. For your other providers, for social workers, you may not be affiliated with a school. It may be with CCNC or one of these other case management networks. You may be providing for Medicaid patients. Same thing with pharmacy. Who knows where you'll be? It could be a community health center or wherever. But I know you all are going to continue to do this, and I applaud you for that. So just kind of in summary, again, with all the things we've talked about, I think my son just wraps it up best. It's just common sense. It's just natural. It's just innate. If you have a service that can improve somebody's health and they can't pay, you help them anyway. You find a way to help them anyway. And that's that spirit that drives everything. And no matter what happens in this country with health insurance or with the payer status or whatever, people in this room and people beyond are going to continue to do that. And I think we just need to get back to how we were when we were kids and just remember that whenever you get into politics or talk different kinds of things like that with people, just remember, just help other people. It makes sense. And it makes sense that you're here. And I do thank you for being here. Just a few quotes, and I'll end with that, is from Father Joseph Tishner, who's a Polish priest. He quoted the self. So he always talked about this thing called the other, which are anybody that you're not familiar with. Maybe somebody from a different background, somebody who's from a totally different neighborhood or lifestyle that you're from. And he talks about you being the self and them being the other. The self not only has to relate to the other, but must assume responsibility for him and be prepared to bear the consequences of such a decision, such an attitude. So, is that a paternalistic point of view? Do we feel sorry or pity for the people that we're taking care of in free clinics or wherever we're serving? No. It's just showing that we're different. We're all different. The anthropologist Malinowski said, there are no superior or inferior cultures. There are just different cultures, which satisfy the needs and expectations of their members in different ways. Friendliness towards another human being is the only attitude that can touch a chord of humanity within him. And he defined humanity as showing every form of kindness to newcomers. So, last most important picture is my wife would be very upset if I show pictures of everybody else except for her. There she goes. And, you know, people are always throwing up pictures of their family. I'm proud of my family. But who's my family? It's not just the people you see on the screen. It's you. You're my family. All the patients we run into, those are my family. And same thing with you all. As you reach out and you see people in free clinics, you see people in your own clinic, people with insurance, people without insurance. Just continue to remember that spirit that made you do what you want to do. You treat everybody like family. If people are in trouble, you help them out. It seems like a silly, basic, bland message, but that's what we're here. That spirit. We help other people. Again, for me, it's my faith that drives me. For other people, it's other things. It may be a mix of a lot of different things that drive you, but it just makes sense. Somebody who's poor, you show compassion, you help them. Someone needs help, you help them. And that's your entire family. For me, every person I run into, that's my family. Who's your family? Thank you.